Hello, I'm Dr. Rosy Daniel and I'm the Medical Director of Health Creation. Health Creation is an organisation working to train people in holistic health coaching and consultancy for application with either individuals or entire organisations that wish to adopt positive, proactive healthcare strategies. So we're now looking for people who would like to train in health creation to start a wave of positive health going right across the United States of America, Great Britain, and on from there around the world. Because these changes are within our own grasp if we have the personal will and the motivational support to make these changes. The results we've achieved with individuals have been brilliant. I'd like to just tell you about a head teacher called Simon who was right on the verge of breakdown, physical and mental. He was very depressed and anxious. He had chest pain, back pain, breathing problems with asthma, and was right on the verge of coming out of school on what would have been a long-term absence, and that would have meant a failing school. In just 7 coaching sessions over 7 months with our head of health creation at school, he was able to learn to do what he called putting the oxygen mask on himself first. He learned how to take care of his energy, his nutrition, and particularly how he was around self-stressing, perfectionism, workaholism. So he changed his behaviour. After these 7 sessions with Simon, he was off all asthma medication, no chest pain, and he didn't have to miss one day at school. His back pain had gone, and he described himself as being back in his trousers. He'd found again his stability, and what's more, he learned how to model this new self-care behaviour to everybody else in the school. The students that we look for are people who have a background understanding of the holistic approach to health and the interrelated nature of body, mind, spirit and environment. We look for people with some good communication skills, people who can connect and actually empower people. My own background is as a medical general practitioner, but I specialised way back in 1985 in holistic healthcare. I joined a major British charity, the Bristol Cancer Help Centre, to pioneer a very positive, wholehearted approach to people getting involved in catalysing their own health and well-being. So now I would be called an integrative medicine consultant because I help people to get the very best of all worlds, medical, complementary and self-help. Around the millennium, after 15 years working mainly with people with cancer, I thought, why not bring this all back up the river? Why not see if we can prevent people getting ill in the first place? So Health Creation was born with the idea to shift our focus away from passive health management to proactive health creation. The reason I felt so inspired to do this is because as a society we're drifting into preventable lifestyle illnesses, cancer, heart disease, asthma, allergies, diabetes, obesity, depression, you name it. And this is meaning now that most of us can expect to have a degenerative disease like this as we go into middle and older age. But this is a nonsense because this is all about how we eat, how we exercise, the levels of stress that we endure, and all of this can be changed. Health creation can be applied in a fantastically wide range of contexts. It started with health creation for the ill. We also now reach out to carers because they too are facing a huge challenge, often very stressed and often neglecting themselves. Then we went forward into organisations, so hospitals, schools, universities, businesses, any context where people are stressed, which is most organisations, and needing to adopt exciting proactive healthcare strategies. But our latest thing is spiritual mentorship for people facing the life-death transition. Our Our students for health creation come from a wide spectrum of background, very often people in healthcare backgrounds like nursing, complementary therapies, or self-help teachers, yoga, healers, nutritionists. But it does widen out to people who've been through illness themselves and their carers, people who are saying, my life has been transformed by holistic approaches, now I would like to catalyse that journey for somebody else. But actually we get people coming in from management, from schools. In fact, it was a head teacher who catalysed the entire development of health creation at school. The health creation mentor is vital to help people understand their state and needs, become really clear about what needs to change, but then to provide the crucial motivation and support and resources to help motivate that change. Very often around month 2 or 3 in the mentoring process, that's when people hit their resistance. We can all make a list of things we'd like to change, but do we change? Not always. So the mentor is there to help people identify those obstacles or resistances to change and to make really profound change that can catalyse a lifestyle based on really authentic values and a much, much happier, more fulfilled person at the end of it. I'd like to introduce you to Sue Caden, who is my lead trainer in health creation. Hello, Sue.
Hello, Rosie.
First of all, perhaps you could explain what has being a health creation mentor meant for you?
It's been the most fantastic thing that I have done in my life, to be really honest with you. It also has been the most incredible personal development work that I've ever done, and to be honest, I've done a lot, a great deal. This training just absolutely blew the lid off everything else that I'd ever done. Because doing the mentor training isn't about being a coach. It's about getting right to the heart in one's relationship with another person, finding out what it is that makes them tick, finding out what it is that motivates them, connecting them with their life and soul purpose in many, many cases. And that is such an incredible privilege.
I think that's really important as a differentiator from life coaching, because in life coaching it's a lot about the outer, what goes on with the person's achievement, their money, their career. But we're working a great deal with the inner and the state of fulfillment, and as you say, right through to the soul contract of that person in their life, and are they on track and on purpose.
And also, as mentors, we work at our clients' pace. What I mean by that is some people really want to deep dive. They really want to get right down there to the core, find the key that will unlock the deepest meaning and purpose for them. Other people perhaps want to skim a little more on the surface. So we always, if you like, are holding our clients and working at their pace and at their level to go as high, as wide, as deep as they choose to go.
And of course, behind this medically is the fact that when people do come alive, when they do reconnect with their purpose, their energy jumps up, their nervous system, their immune system, and we see spectacular healing change.
We see transformation in many cases.
When we're working in a holistic health coaching model, what we're trying to work out is the balance between what's going on in the care of the body, the mind, the spirit, and the environment. And for the client, that's not always obvious. So this tool, the Picture of Health, is one of 5 tools within the programme where people can really get to see crystal clear what's going on and where the work is needed. So people answer a questionnaire with 10 questions for how they eat, their physical needs, their toxicity, and so on around the mind principles, the spirit, and the environment. And there are 10 questions for each with simple yes and no answers. People then plot their yes scores from 0 to 10 and join up the dots and shade in this central part. And so you can see the blue area represents what's actually right about a person, where they're doing really well, but the gaps around the outside show us where the issues are. So this person has got a problem with their stress, relationships, emotions, not very much relationship with nature. And what the mentor can then do is see in the big picture and the client, actually my relationship with my body is quite strong, but where I'm suffering is in the mental zone, in my emotions. Spirit, quite strong, but pretty out of touch with my environment and the nurture that I could be getting from my environment. So this starts a conversation between the mentor and the client. What does the client see? Which of these questions are the ones that we need to home in on and perhaps create a health creation goal around? So there's a second version of the picture of health views in organisations where the questions are turned round the other way. So how is my organisation caring for my mind, my body, my spirit, my environment? So how is my organisation making me aware? How are they assessing me, supporting me, teaching me and resourcing me? So then for organisations we can make health creation goals for the whole organisation. We've done large-scale pilots with health creation in organisations and with leaders of our healthcare system here, our National Health Service. And with the work we did with leaders, we reduced stress levels, depression, anxiety. We raised well-being by about 30%. And people said that this was between 80, 90 and 100% essential in their role as a leader. Most of them had never had any attention like this ever before. The training in health creation starts with a foundation year, which we call our mentor training. It goes on over 6 months of face-to-face training, and then with a second 6 months of probationary work as you work with your study clients. This is a fantastic experience, and straight away when you get into that, you will be peer mentoring another student through the health creation process, so you'll very quickly get hands-on experience. The second part of that training, Module 2, is actually the theory part, and this is mainly online, so that as you're working to understand our 12 health creation principles, you're going deep into the evidence. Why is the nutritional approach so important? What evidence is there for the impact of exercise and stress, emotions, relationship, authenticity, spirituality, community, you name it. So this is for those who really need to know the bottom line facts and figures of just how important all of this is, because it's very important when we're working either as a mentor or a consultant that we feel scientifically bulletproof. The second year of the training is the elective year for those who want to go further. So at that point, the road tends to fork with those who either want to go into consultancy, taking health creation into organisations, or those who want to go into spiritual mentorship, deepening their skills to work with people in a very sensitive place approaching their death and dying. So the question is this right for you? Do you feel attracted to come and train with us in health creation and be part of this fantastically exciting wave of positive health, which is vital for all of us? If you would like to get in touch, email us, telephone us, either in the United States or in the United Kingdom. We can set up a call with either my training managers or me to go through your own inquiries. How would this work for you? Where would you apply it? And what exactly would the training involve? We will ask you, if you'd like to train with us, to have a few sessions before you train yourself so that you can experience the methodology and just see exactly how it works. So we look forward to hearing from you and welcoming you to our health creation family.